we come on to the third case. 24-year-old Mrs. Fibroid, anesthesia colleague, right, a medico, underwent ultrasound abdomen and pelvis for travel visa purposes to UK and found a fibroid of 4 centimeters by 4 centimeters in the anterior wall body of the uterus intramural, and she's asymptomatic. That's why she's not come to us before. But having said that, she's got an asymptomatic fibroid. She comes to you or me for enough clarification and doubts. She's an anesthetic colleague, and so she's quite well versed about what a fibroid could have complicated. Her questions are: can fibroids be so asymptomatic, or will they grow in future? Can you stop the growth of the fibroids? Will it compromise my fertility because I'm traveling now? Will it become malignant later on? If at all, can I wait or should I do something at a 4 centimeter asymptomatic fibroid? First question, can fibroids be so asymptomatic? Oh yes, the answer is yes. And having said that, if you see the age-old textbooks for a fibroid, 40 to 50% of fibroids are asymptomatic. That means if you screen a girls' college classroom with 200 students in a medical college, there will be 100 girls in the college. That means there will be almost 40 to 50% of the girls with a small fibroid. They will live with it without symptoms. They will have children and they will probably die with it. So fibroids can be so asymptomatic. But having said that, when fibroids are asymptomatic, fibroids, if they are symptomatic, they can be terribly symptomatic. What can the symptoms be? The symptoms will start with menstrual complaints, for the example being menorrhagia, dysmenorrhea. Metrorrhagia if it's a cervical fibroid, uterine contour disruption to produce an infertility, or if it's going to be sitting near the conoid, prevents the tubal takeoff, sperm entry and prevents of fertility, or if it's going to be sitting submucous, prevents implantation. If it's going to be sitting at the cervix, butting into the bladder, it can produce with recurrent urinary retention with a history of patient coming back to you with the recurrent catheterization and nearby hospital or self-catheterization. So fibroids can be very, very symptomatic if they are symptomatic. But having said that, they can be asymptomatic also. 50% of fibroids can be asymptomatic, and the symptoms would depend upon the size, number, age. And please understand, if ain't broken, don't fix it is the principle, and do no harm principle works good. And you have to understand that imaging techniques, whatever, whether it is ultrasound or an MRI, may not be able to pick up a fibroid which is less than 1 centimeter. That is, a sub-centimeter fibroid can be missed, and the fibroid can remain growing by a very slow length, and it can be asymptomatic like this particular colleague friend of mine. Whether this fibroid can grow, can we get some therapy to stop them from growing, is the question which is coming to you with for a discussion. Uncertain, we can't give any answers. Oh, fibroids, can they grow? Yes, they can grow, and you need to follow up. How can you follow up? By imaging, because they can still be asymptomatic. Growth cannot be stopped by any therapy, and it is not worthwhile doing it, because it's like growing a gray hair. You could have a gray hair and still live with it, or you could cut it, dye it, etc., but you will continue to have it again. So a gray hair is a gray hair, and the fibroid you have, it will have unless you do some therapy for it, and you can't stop the growth of the fibroid. Do I need any treatment? Is there any standard guideline for treatment of asymptomatic fibroids? Yes, the answer is here. There are guidelines by the New Zealand College. New Zealand Guideline Group came out with enough symptoms to say enough therapies for asymptomatic women and guidelines for managing an asymptomatic fibroid. Asymptomatic women with fibroids of uterine size less than 16 weeks do not need further investigations. Uterine size of more than 16 weeks pregnant size should have a specialist referral. Myomectomy is indicated only in infertile women with distortion of the endometrial cavity where no other factors are responsible, and in women who would probably undergo in vitro fertilization. And concern about possible complications related to fibroid in pregnancy is not an indication for myomectomy other than in women who have previous pregnancy complications with fibroid. We'll come to that a little later. Women with fibroid and pregnancy require additional fetal surveillance when the placenta is implanted over the fibroid. Size of the fibroid does not influence the removal. Possibility of a sarcomatous degeneration, as what I told you, is much less than 0.1%, and therefore not a justification for removing the fibroid at this particular age, because they will never probably turn.